Hello everybody. We'll be talking about liver disease and liver cancer in this video. Liver cancer can happen in both males and female. It is a cancer of growing age. What are the common risk factors for liver cancer? Liver cancer can happen to anybody, but yes, there are certain risk factors. Now, liver cancer happens in chronic liver disease. That means if the liver is impaired, the function is impaired because of any reason, and that also we'll discuss, then the cancer can happen. Because with chronic liver disease, with chronic impairment of liver functions, the cells are damaged, and cancer is a disease of damaged cells. So liver gets damaged because of alcohol intake. Now the alcohol intake has become very common in the country, and that is why alcohol induced liver damage is also increasing. Besides alcohol, the other risk factors are viral infections. Yes, certain viral infections can also cause liver disease, which in turn can lead to liver cancers. Important ones are hepatitis B and hepatitis C. Besides these, we are also seeing that liver cancer is rising because of unhealthy lifestyle. That means if you have unhealthy eating patterns and if you don't exercise, what happens is that liver takes a hit. The liver is an organ which detoxifies the various toxins in the body, and it's responsible for maintaining a healthy metabolism. So it undergoes periods of stress because of unhealthy lifestyle that leads to accumulation of fat in the liver, and that accumulation of fat in the liver causes liver damage, which over the period of time can cause liver cancer. This is actually becoming a very common cause of liver cancer, especially in females. So these are the main risk factors which can lead to liver disease, and that in turn can lead to liver cancer. So like I said, that liver cancer is a disease of increasing age. So if any person is having some kind of liver disease, then the chance of having liver cancer increases. So any person with diagnosed liver disease should be followed up periodically with certain blood tests and monitoring of signs and symptoms to see if the cancers are developing. Liver is an organ which is situated in the right part of the abdomen or in the tummy. So if the liver cancer starts to happen, there will be nodules or the lump formation felt. There could be pain. Also, sometimes there could be increasing jaundice, fluid formation, loss of weight, loss of appetite, fatigability. And cancers in extreme of cases can migrate in the parts of the body. If it goes in the lungs, we'll have breathlessness and chest pain also. So it's very important to recognize signs and symptoms. So any patient in your family, if has some kind of liver disease, then that person should also be kept in the follow-up for the detection of liver cancer. If the liver cancers are suspected in anybody, how do we investigate? There are certain blood tests. For many cases of liver cancer, we actually don't require a biopsy. We're only by certain blood tests, and sometimes by doing an imaging, we can actually find out if there is formation of cancer. And once we find out if there is cancer formation, we treat. The small lesions, if only limited to the liver, they can be easily treated by the surgery. But sometimes when you have a bad liver and you have a lot of cancer, then we actually require liver transplant that will also deal with the bad liver part or the chronic impairment of the liver. So what is important is the liver cancer usually happens when the liver functions are already impaired for more than one reasons, and where you need to treat the liver impairment also and the liver cancer also. So yes, in many cases, if the cancer is spread in the body, we would like to treat all the sites of the cancer, and in those cases, we give some kind of systemic therapy with the cannula. So what are those? Immunotherapy and the targeted therapy are the two latest advancements for the treatment of liver cancer. So how do we protect yourself from the liver cancer? So a very healthy liver is the most important thing. If you maintain an active lifestyle, a healthy lifestyle, you can protect yourself from liver cancer. Eat healthy. Also exercise. At least 5 days in a week, you are exercising. Just brisk walk for half an hour is very good. And if you are taking a diet which is rich in antioxidants, decrease red meat, decrease processed meat, take as much as possible whole grain diet in your normal eating habits. So all these will help to decrease the chances of liver cancer. Cut down on alcohol intake, and yes, get vaccinated with hepatitis B vaccine so that you get lower chance of having hepatitis B. Protect yourself and be healthy. Thank you.